Hi, my name is Tanisha Cajas, and I'm going to talk about niraparib in patients with newly diagnosed advanced ovarian cancer. Definition: ovarian cancer is often found when it has spread to the pelvis and abdomen. At this last stage, ovarian cancer is more difficult to treat. Niraparib is a PARP inhibitor with significant activity in germline BRCA-mutated tumors that also showed activity in those with unmutated BRCA, as well as in tumors harboring homologous recombination deficiency (HRD). Therefore, both studies recruit patients regardless of BRCA status.
Ovarian cancer is a subtle disease. It can sneak up on us like a thief in the night, disguised as common problems such as prolonged bloating, the constant need to pee, and fatigue. While the warnings are the same, the most common type of ovarian cancer begins in epithelial cells, a type of cell that makes up the tissue covering the ovary surface. To best treat ovarian cancer, doctors at Roswell Park first confirm the diagnosis and learn the stage or extent of the cancer. This requires a procedure called surgical staging, during which a surgeon carefully examines your pelvic and abdominal areas. The stage of ovarian cancer is determined by where cancer cells are found in the body. In stage 1, ovarian cancer is found in or on the surface of one or both ovaries or fallopian tubes, or in fluid collected from the abdomen. In stage 2, the cancer has spread from its initial site to other areas of the pelvis, such as the ovaries, fallopian tubes, and the uterus. Finding cancer only in the lining of the abdomen is also considered stage 2. Stage 3 means that the cancer has spread outside the pelvis and is found in other parts of the abdomen, nearby lymph nodes, or on the surface of the liver or spleen. The cancer has reached stage 4 when it spread beyond the abdomen into other parts of the body, such as the liver, lungs, bones, or in the lymph nodes in the groin. At Roswell Park, we have a highly experienced team of board-certified gynecologic oncologists who focus specifically on gynecological cancers. Know your body. Ovarian cancer whispers, so listen.
Applications in medicine. Niraparib administered improved progression-free survival in patients with ovarian cancer regardless of BRCA status. As the tumor grows, some symptoms may begin to appear, such as loss of appetite, feeling, or abdominal fullness after eating, even if it's frugal, or weight loss. In general, fluid usually accumulates in the abdomen, causing what we call ascites, which can be very important, causing distension of the abdominal cavity. Fluid may also accumulate in the pleura around the lungs, causing shortness of breath or feeling short of breath.
Niraparib was actually approved in the maintenance setting. It's the one unique PARP inhibitor that doesn't have the treatment indication yet. So this should follow platinum, actually 2 prior platinum therapies. The Niraparib also is approved without any indication for molecular testing, so we don't need to know the BRCA status for these patients. So what we've learned from these trials is there are manageable toxicities with Niraparib. We know that platelet toxicity is one that's probably most notable, and certainly as a clinician, we need to be on our toes for this, that we should be monitoring our patients closely and doing weekly labs for the first month, and then anytime we make dose adjustments, we should be doing weekly laboratory studies with the CBC monitoring platelets. And we've actually identified a population of patients that are thinner and coming into the starting therapy with a lower platelet count. So I believe if their weight's less than 77 kilos or their platelet count's less than 150,000, we want to think about probably starting those patients on 200 milligrams per day rather than the normal 300 milligram starting dose. The PRIMA trial is their upfront trial looking at standard chemotherapy followed by Niraparib, and this is a randomized trial. Again, we hope to have those results out in early 2019. Quadra is a trial with Niraparib really designed to have Niraparib end up with the same type label indication as the other two PARP inhibitors. So this is in patients that we have in a treatment type setting, and the preliminary results, or at least that have been released publicly, show this to be very active in patients with both BRCA-mutated status, wild type, platinum resistant, platinum refractory. We see actually quite nice response rates in that population. I believe we'll see another formal presentation of this at ASCO here 2018. The other trial I would like to mention is Topacio, which is a combination of Niraparib plus a PD-1 inhibitor. This was presented at the SGO 2018. I think there'll be an update at ASCO 2018 showing a very nice response rate and disease control with a combination of an immunotherapy agent and Niraparib.
Pros and cons. Pros: improve survival, significantly lower risk of disease recurrence or death. Cons: nausea, vomiting, constipation, heartburn, dry mouth, canker sores in the mouth, loss of appetite, and back pain.
So this is a trial that started a number of years ago. It's called the NOVA trial, N-O-V-A, and it's examining the PARP inhibitor called Niraparib. Niraparib is an oral PARP inhibitor. It's very potent. And the trial design is that women had to have platinum-sensitive recurrent ovarian cancer. And not just that platinum when they sort of were entering into the trial, but the penultimate platinum as well, meaning the second to last. Their cancer had to show responsiveness to the agent platinum. They also had to have a special type of histology called a high-grade serous ovarian cancer. And then also the groups were broken into whether or not women had a germline BRCA mutation, or if their cancer had the test called the homologous recombination deficiency test. Basically a test that would indicate possibly that that cancer would be more sensitive to a PARP inhibitor if the tests were positive versus negative, really taking out the germline BRCA, that kind of being a very major driver of PARP inhibitor sensitivity. So it was a 2-to-1 randomization. Several hundred patients were enrolled. The data has now been published in the New England Journal. It was published late 2016, showing an improvement in the median progression-free survival for women who received Niraparib versus placebo.
Issue applied in Ecuador. If there are enough proven cases in Ecuador of the use of Niraparib for advanced ovarian cancer, which helps a woman survive and reduce the risk of death.
The study we presented here was on patients with recurrent ovarian cancer. Ovarian cancer is quite a frequent disease that in the first line setting needs extensive surgery, chemotherapy, and with this we can cure a certain amount of patients with advanced disease. However, the majority of patients recur at some point, and usually at the recurrence, if it was not a very fast recurrence, but a recurrence coming after a few months, we retreat them with chemotherapy. And what we examined in the study we presented here at ESMO was to examine a maintenance treatment after recurrent chemotherapy with a PARP inhibitor called Niraparib. We observed a large benefit for this maintenance therapy with Niraparib. We compared it to placebo in a broad patient population, actually 2 patient populations, one with a known germline BRCA mutation. BRCA is a gene that is involved in DNA repair, and we know that these patients first respond quite well to platinum chemotherapy and then appear to respond quite well to PARP inhibitor therapy as well. And then we also examined a patient population without this germline BRCA mutation. And the surprising result we saw is that both patient populations really did better if we treated them with the PARP inhibitor Niraparib, irrespective of the BRCA mutation in the tumor or in the patient.
Conclusion. Niraparib significantly reduced the risk of disease recurrence or death by demonstrating significantly improved FPF in patients with newly diagnosed advanced ovarian cancer.
The last presentation was on patients with recurrent ovarian cancer. And the investigators used Niraparib as maintenance for those patients, independent of the BRCA mutations or HDR alterations. So it's very important. You can see that most of the patients, they do benefit. They have less progression-free survival events. So it's a very effective treatment. Toxicity was manageable, was well known, similar to the other trials that have been reported. So this is really an important treatment for the patients with ovarian cancer. That's a new possibility because you didn't have this before. We have bevacizumab as maintenance in Europe, but the benefit is not similar. So this is a very important. And the most important, all these three presentations this morning, they have been published online in the New England Journal of Medicine. So it really is breakthrough. It's really changing practice for our patients. I think the question on platinum-resistant patients. We still see a lot of patients, they are resistant to platinum chemotherapy, and this is still a population that we do not have many options, so we need to investigate more. In this population of the ovarian cancer, they were platinum sensitive. So I think you need to study the other combinations or Niraparib being platinum resistance.
Thank you for watching.